I'm going to show you how to get your hair back in 60 seconds. I'm Dr. Rob Berberian in Newport Beach, California. Who am I here with today?
I'm Brian. I'm from Colorado.
Well, welcome all the way from Colorado. How are you liking California?
I really like it so far. It's very gorgeous, very scenic, so I'm very much enjoying it here. Yeah.
Ready for some torture then?
Well, I'm ready for a very expensive haircut, I think. So.
Perfect.
Yeah.
So what made you want to get a hair transplant?
I think I'm just getting to that point where I'm in my late 40s and just starting to feel a little older. So for me, it's just a pure vanity move. I just want to look younger.
Perfect.
So, yeah.
Well, you're in the right place. We'll take care of that. So for Brian, the plan is to do 2,500 grafts. He's pretty tall, so we're really going to focus on the front part of it, redesign his hairline in a very natural and artistic way, fill in the temples, fill in the front half, and then add a little bit in the crown as well to give him maximum density with one procedure. So are you ready?
Yeah, sounds like a good plan. Thank you.
All right, we're going to get started.
Yeah. I think you did it. I think you nailed it. So I like that it's not like
very straight.
Straight, yeah.
Yeah,
It
it's
has
very
to have
natural
natural, yeah.
Yeah, so it basically mimics your natural born hairline in a very artistic way. So that way there's no dead giveaway that this is a hair transplant.
I know those people like to really lower their hairlines and it's so flat, it looks fake. Like
it looks artificial.
Yeah,
exactly.
yeah.
It's a dead giveaway.
Yeah.
So this way nobody will able to tell that you had a hair transplant.
Except if they watch TikTok, then I'm...
Exactly. If you're on TikTok,
please stay away from TikTok, everybody.
So we are doing PRP for Brian today. The advantage of the PRP is two things. Number one, it allows the transplanted grafts to hold on better because it kind of acts like natural glue. And number two, it expedites the regrowth of the transplanted grafts. Now, Brian still has a lot of native hair, so the PRP will actually help preserve the existing native hair and help prevent future hair loss. So you're getting actually 3-in-1 benefits with one simple procedure. If you want to apply a little pressure, that's it. So ready for your best haircut, your special haircut?
Indeed.
We're going to give you a special fade. It's the TikTok
Zero,
fade.
yeah.
That. It's like a reverse mohawk.
I feel like you're gaming me here.
We just finished all the extractions. It was done manually by hand, one by one. We did 2,500 grafts on Brian. So how was the experience for the first part?
The first part, I guess the thing that I really appreciate is just the skill that goes into making the extractions. We learned my scalp has quite a bit of variability to it.
Yeah.
So I guess I appreciated you and your team just looking at that as an opportunity to showcase your skill and with the extractions, changing the depth and the speed to make the extractions work. So I appreciate that.
It came out really nicely. You actually had good groupings. We got some 3s and we got some 4s as well. And we had some singles and doubles. So it was really a mixture. Your donor area was very unique in the way it had zones that were really dense and it had some zones that was very, very fine. So it was a little bit of a challenging case, but there's nothing we can't do.
Hoping for a great result. So
no pain so far. Feeling comfortable?
No, I feel energy is good. I'm on Valium right now, but I feel relatively alert. So all things considered. So,
all right, you ready for the next part?
Yeah.
So the next part, I'm basically gonna do the sides in the front and the crown, and then place the grafts.
Great.
Now that we finished making all the sites, we made 2,500 sites. I'm going to inject the PRP that we drew the blood a little bit earlier. So how was the process of making the sites? How did you feel?
Oh, that was pretty straightforward. Didn't take very long at all, maybe 45 minutes.
And no pain during that procedure?
There was some slight pain, but you gave me the numbing agent and it was fine. So.
Perfect.
Yeah.
All right, so this is the PRP. You shouldn't really feel much. Are you feeling anything?
No.
Good. So the PRP is going to help expedite the regrowth of the transplanted grafts, but it's also going to protect the native grafts from shock loss. And it's going to allow expedited healing, so less redness, less inflammation. and it's going to help you as well decrease native hair loss. So typical maintenance for PRP is recommended once every 6 months. And this way we inject the PRP everywhere from front all the way to the crown. And done. All right, we just finished Brian's FUE hair transplant. How was your experience before we do the big reveal?
Yeah, I guess first off, I just appreciate your attention to detail.
Thank you, appreciate it.
Yeah, I think your skill and artistry was apparent in the process, and I really appreciate that. And then
Thank you very much.
The second thing would be just your appreciation of my, if I needed, additional numbing, or if I needed additional comfort, you just were there and supported me in all of that. So I appreciate that.
It's my pleasure. We want to make this experience as pleasurable as possible for you. Since we know it's a little tough procedure because it takes about 6, 7, 8 hours to do this. So we appreciate your patience as well. So we're going to do the big reveal. If you want to take a look.
Oh wow, okay.
You want to come a little closer. So
yeah,
this is your brand new hairline. Congratulations.
Yeah, thank you.
We did 2,500 grafts. We focused about 2,000 grafts on the front part and then just about 500 in the crown.
Yeah, I have every reason to think this will be successful, but time will tell, right?
Exactly.
So,
it takes a little bit. You did the PRP,
science,
so that's going to expedite the regrowth. And if you want to wrap around a little bit to show the donor area, it looks amazing. So if you want to look towards me, so we can get the back.
Oh, okay, I got you.
Perfect. Wonderful.